Preventing Scoliosis Progression. Chapter 1. Rethinking Scoliosis as a Systemic Condition. Scoliosis is usually thought of as just a curve in the spine. Most people imagine it as a side-to-side bend that happens for no clear reason. Doctors often look at it as only a bone problem or a posture issue. But what if scoliosis is more than that? What if the curve is just the tip of the iceberg, and there are deeper reasons inside the body that cause it to develop or get worse? New research is showing that scoliosis isn't just about the spine. It can be a full body condition. It may be linked to genetics, hormone changes, and imbalances in the brain's chemical messengers, called neurotransmitters. This means that scoliosis might start in the spine, but it can be influenced by things happening throughout the body. That's a big shift in how we understand scoliosis. It also changes the way we think about how to treat it or prevent it from getting worse. If scoliosis is connected to other body systems, then just focusing on the spine, like with bracing or surgery, might not be enough. We need to look at the whole person. This includes what's happening in their brain, their hormones, their nutrition, and even their genetic makeup. When we look at scoliosis this way, we open up more ways to help. For example, some kids and teens with scoliosis have brain chemistry that's out of balance. Others have hormone levels that are changing too fast, like during puberty. Some have inherited certain genes from their parents that make their spine more likely to curve. All of these things can act together and make the scoliosis curve get worse. But the good news is that we can test for many of these issues. And once we know what's going on, there are things we can do to help the body work better. And that can help slow or even stop the curve from progressing. That's where this book comes in. If you or your child has scoliosis, or if you're considered at risk for scoliosis progression, it's easy to feel helpless or overwhelmed. You might be told to wait and see if the curve gets worse, or to wear a brace every day for years. That can be scary and frustrating. But this book offers a different message. You are not powerless. There are real, science-based steps you can take to understand what's happening inside the body and take action early. You don't have to sit and wait for things to get worse. In this book, we'll walk you through 6 key predictors that have been shown to increase the chances of scoliosis curve progression. These predictors are not just random guesses. They're based on real research and real patient cases. When someone has one or more of these predictors, they are more likely to see their curve worsen over time, especially during growth periods. But knowing about these risks ahead of time means you can do something about them. Let's take a quick look at what these 6 predictors are. Low serotonin levels. Serotonin is a brain chemical that helps with mood, sleep, and body posture. Low levels can affect how the brain and spine work together. High histamine levels. Histamine is part of the immune system and can affect inflammation. High levels might interfere with muscle tone and nerve signals. High norepinephrine levels. This brain chemical helps control stress and alertness, but too much can make the nervous system too active, affecting posture and balance. Low progesterone to estradiol ratio. Hormone balance is key during puberty. An imbalance can weaken bone and muscle strength, especially in girls. 14 or more genetic functional groups linked to scoliosis. Some people have many genetic differences that all work together to increase scoliosis risk. Having both the MTHFR and COMT genetic variants. These 2 genetic variants affect how the body handles nutrients and brain chemicals. When both are present, it may raise the risk of curve progression even more. Each of these 6 markers is a piece of a much bigger puzzle. You don't need to have all of them for scoliosis to become a problem, but the more of them you have, the higher your risk becomes. That's why early testing can make such a difference. When we can identify these markers before or soon after a scoliosis diagnosis, we can take steps to rebalance the body and support the spine more effectively. So how do you test for these markers? There are non-invasive options like saliva, urine, and blood tests that can check neurotransmitter levels, hormone ratios, and genetic variants. These tests are becoming more common and affordable. Once the results come in, they can guide a personalized treatment plan. Instead of using a one-size-fits-all approach, this method treats each person based on their unique biology. For example, someone with low serotonin might benefit from certain foods or supplements that naturally boost serotonin production. Someone with high histamine might need a special diet or natural antihistamines. If a genetic test shows both MTHFR and COMT variants, a doctor might suggest methylated B vitamins and stress support therapies. This is not about replacing all traditional treatments. It's about adding new tools to the toolbox. Yes, exercises, physical therapy, and postural training still matter, but they work better when the body's chemistry is in balance. Imagine trying to build a house with crooked tools. It doesn't matter how skilled you are, it's going to be harder to build something strong and stable. The same is true with scoliosis. If the body's internal systems are off balance, it's harder to get the spine to respond well to treatment. Another important message in this book is that scoliosis is not your fault. Many families blame themselves or feel like they did something wrong. That's simply not true. Scoliosis is a complex condition, and many factors, especially hidden ones like genes or hormone levels, are outside of your control. But learning about these factors can help you take back control of the future. Knowledge is power, and understanding your risk allows you to make informed, confident choices. Throughout this book, we'll take a deep dive into each of the 6 predictors. We'll explain what they are, how they affect the body, and what steps you can take to address them. We'll also share real stories from patients and families who use this information to change the course of scoliosis in their lives. These stories will give you hope, guidance, and encouragement to start your own journey. By the time you finish reading, you'll have a full picture of what scoliosis is and what it isn't. You'll see how looking at scoliosis as a whole body condition opens new doors to prevention and care. You'll understand that you don't have to rely on luck or wait for things to get worse. You'll have a plan and the confidence to act on it. This new way of thinking about scoliosis is not just about treating the spine, it's about supporting the whole person. And when the whole person is healthier, the spine has a better chance of staying strong and stable for life. Let's get started.